We have two final speakers with us today, and we'll turn to talk a little bit about some consumer-facing education and opportunities on this topic. And our final speakers are Rick Young, who is a longtime Frontline producer. He also launched a production partnership between Frontline and the Investigative Reporting Workshop at the American University, and he's joined by Larry Kirkman, a professor of film and media arts in the School of Communication at American University and part of the Investigative Reporting Workshop. NIHCM Foundation provided journalism grant support for a project to educate the public on antimicrobial resistance, a project that was based on Rick's documentaries on this topic. Including one called Hunting the Nightmare Bacteria, which also won NIHCM's Television and Radio Journalism Award back in 2014 and was recently revamped and re-released last year and also incorporated into Larry's project that we're going to hear a little bit more about today. So, Rick and Larry, are you both with us?
Yes, I'm here.
Okay, we'll start with Rick. We're going to start with you.
Yeah, sure. Well, thanks for the opportunity. I basically just want to. I know everybody's been at this for a little while, and probably a lot of questions out there. So I'm not going to take too much time, but wanted to just sort of offer more or less an observation about our projects and how we got into this. And this goes back about 6 years. So some of this may be a little dated, but at the time, basically the issue, I don't think certainly resistance had quite the public profile that it does now. And we got into this really because David Hoffman, who was the correspondent on Hunting the Nightmare Bacteria, had gone to the NIH, and this was not long after the outbreak at NIH had occurred, and he talked to them, and NIH, the folks there, the doctors, and the institution itself, was willing to actually sit down and talk about what happened there, which was pretty unusual. Their willingness to step out and publicly discuss an outbreak that had happened at the Institute. And so that was pretty much what got us started. But as we got into it, we immediately knew it, and this is a truism for journalism and certainly storytelling, that you need compelling characters, et cetera. So we went out to try and find stories to tell. And my observation here is that actually the most challenging part of this whole process for us in the films that we made was actually, and also the key to making the stories work, was getting access to hospitals in that case. And we had a lot of trouble. And I think, it's sort of understandable. Hospitals didn't want to talk about problems within their walls. But that was really the key, the fact that we were able to get some institutions to step forward. And I don't think it's coincidence that those institutions were research-based hospitals. The for-profit hospitals, we had absolutely no luck whatsoever in getting them to be willing to open up and talk about what was happening. And I don't know, I said, this was 6 years ago, and I haven't been back at it really, although we go back and update it, and we were in Houston at Houston Methodist. But I suspect the problem is still there. And I think that it wasn't just the ability of or willingness of and hard work of the infectious disease doctors that we were working with, but it was their ability to talk to and convince leadership at University of Arizona, at Harborview Medical out in Seattle, as I mentioned, Houston Methodist, for the leadership of those hospitals to decide, okay, we're going to trust you with this story. We know that it may have it can be abused in the sense of becoming a sensational story, and I'm not unaware of the role that the media plays in that. But I do think that, from our perspective, that was the key to actually getting the stories out there, getting the issue out there before the public, was the role that the leadership at the hospitals played in making that tough decision. And I think, going forward, that's frankly one of the barriers in getting the story in front of people, is a willingness to step out there and say, hey, this is a problem that we've had here, but this is why it's so important. And that's going to take a mind shift, a bit of a mind shift away from seeing this as a marketing problem to, the medical emergency that it is and that the public needs to see. So as I said, I'm certainly aware of the role the media plays in maybe the reticence that's there, that these stories can be sensationalized, but we need to do a better job all around, and part of that better job is reaching people where they are, and that's not just through documentaries, which is why the work that Larry has done, I think, is so important, trying new approaches, keeping the work alive that we've done, and I'll throw it over to him. Obviously happy to answer any questions that people might have.
Thank you, Rick. These wonderful films really have made a great contribution to elevating the problems and solutions to AMR. We've used and built on Rick's 2 films to create this interactive production. It was just launched last month, and it complements, in some ways, the work with providers, such as Dr. Priest described in the Blue Cross Blue Shield work, and focuses on reaching everyone, because everyone has a stake in understanding this crisis. And we believe it's our responsibility as communicators to inform and engage people at whatever their level of education or media consumption. As communicators, we make a lot of assumptions about the clarity of our language, about what it takes to interest people, to motivate them. And we need to ask the science communication questions on impact that are not often asked by journalists or filmmakers. What are people getting out of our media? How do we make the problems and solutions compelling? As Dr. Snyder said, the work we do can have a great impact on human overuse and behavior change. It can model provider-patient communication, and it can inform a wider public on the need for policy change and build public will for policy change, for funding for pharmaceuticals in the pipeline, and for standards for food animal farming, as an example. We have to ask where people look for information. We did a survey, and 73% of our respondents said that they would look for information in online search, and in fact 12% of them said WebMD is where they would go first. 60% said that they would look to their health practitioners. So it's important that we have a multifaceted approach to communications on antibiotic resistance. We need to work on many fronts, from media relations and public service advertising to online resources, social media, to films and interactive media. The power of interactive is where's my slide here? Okay, there we are. The power of interactive is that people can move at their own pace. They can follow prompts to get information. They can use a menu to jump from an individual story to a public policy issue to an explanation of the science. We found that they can be surprised by what they can know. One of the assumptions we make is that empathy and fear are tremendous motivators, and that these personal stories that we feature that come out of the 2 films and are put together as segments, that have a strong story arc, that they will drive people to want to know more and pursue the issues that interest them. For example, as someone watches the frightening story of a young girl in the hospital with an infection that does not respond to any antibiotic, they want to know, what can I do to protect myself and my family? And they can follow a link directly to the CDC website, which has such a terrific and well-maintained section on protecting yourself and your family. The interactive gives the user the agency to move from these individual stories to public health solutions. They can go directly to a Pew story and explanation of what's in the pharmaceutical pipeline. They can go to a stat news animation on understanding the science. So it's our job to create a landscape of information and resources that people can tap into, to illustrate that, to demonstrate it, and to be, in a sense, a navigator for them, and to annotate it so that they know what they're getting and why. The 4 stories really allow people to find an entry point that will be meaningful to them. An 11-year-old girl gets a staph infection. Her mother asks, how did she get so sick? How did it happen so fast? It's the story of MRSA and a lung transplant. David, a young American volunteering in India, is injured in a train accident, has his leg amputated, and gets 5 antibiotic-resistant infections. He's brought back to the U.S. for treatment and brings with him the NIHCM Superbug. His doctor says we had nothing left to treat him with. These stories are enormously powerful. And then, as Rick said, there's a big focus on 2 leading hospitals desperately trying to contain the spread of superbugs, the National Institutes of Health and Texas Medical Center. These stories are tremendously motivating for people to want to know more, to know why resistance is growing. And what we found is that across class and educational lines, people did respond to the scale of the problem and the predictions of AMR overtaking cancer as the leading cause of death. They want to know more about the role of pharma and why for 30 years we haven't had a new antibiotic developed. They're interested in the fact that 70% of antibiotics important in human medicine are used in food animal farming. They want to know the role of government, the National Action Plan, the role of investing, new forms of public-private partnerships, and I think the role of public education to reduce overuse and the development of new standards and regulations. The explaining the science section we think is important, answering people's questions, and with the public health solutions to provide positive hope and to really give a sense of what's being done and what people can support. For example, the increase in antibiotic-free food through food companies, the role of restaurants and grocery chains, and what's happening there. So it's important as we go forward to develop this experimental communications model. We've used focus groups and surveys and user studies. What do people know? What more do they want to know? What does it take them to get interested? What are the barriers to sustaining their interest? What works and doesn't work with what audiences? We found that it's easy to get people concerned and interested and that they want to know more. First, information on their personal safety, what they can do to protect themselves and their family, and second, the potential impact of antibiotic resistance, how widespread the problem will be. There's a great challenge that we all face in engaging and informing the public, and it's important for us to work with partner organizations like those who presented in this webinar to shape our work going forward. So thank you.